Hi, everybody. I'm Lauren Abdulmajid, the FMIG National Coordinator and a student at University of Illinois in Chicago. First, happy Primary Care Week to everyone, and welcome to our October episode of Family Medicine on Air. Tonight's topic is going to be about change making in family medicine, and we are very honored to have with us Dr. Glen Stream, a family physician, past president of the AAFP, and president and board chair of Family Medicine for America's Health. Dr. Stream, thank you so much for being with us tonight. What message would you like to share with us about change making?
Well, first, thank you, Lauren, for having me, and I'm really looking forward to this opportunity. First, I'd like to let people know just a little bit about me, so they know, my background as far as what I'm going to say. I'm a family physician. I've been 30 years out of residency, and I still love going to work every day and seeing patients. I did all my medical training in Seattle, Washington. Practiced in Washington State until 2 years ago, and just recently relocated to Southern California. So I've been a little bit around the country in different sort of practice areas. My wife is a family medicine residency director, so this is our life. So what we're talking about tonight is about change in the healthcare system and the role that family medicine can play as a specialty, but also the role that we all as individuals, including medical students, can play. We hear so often about how our healthcare system is broken, and I recently wrote a commentary piece where I said I've heard that since the day I entered medical school many years ago. And so that concept is not new and shouldn't necessarily be discouraging. Healthcare is a complicated endeavor and is always going to be in change, both the medical science and the delivery. But what are people talking about today about what's broken? Well, we know that in the United States, we spend more per person on healthcare than any other country in the world, typically twice as much as the nearest other country, and yet in health measures of our people, we lag behind those countries in things like lifespan and infant mortality and other important measures of health. And so one of our challenges as we look to change our healthcare system is to actually make it more about health and actually to improve the health of our population. So I currently am the board chair and president, as you said, of an effort called Family Medicine for America's Health. It is a collaborative effort of 8 national family medicine organizations, including the AAFP, but important organizations including the American Board of Family Medicine, Society of Teachers of Family Medicine, the Association of Family Medicine Residency Directors, and the department chairs and schools of medicine, the North American Primary Care Research Group, and our osteopathic colleagues, the American College of Osteopathic Family Physicians. So those groups have all come together to sponsor this effort to be a change agent and to speak on behalf of family medicine and act in a manner to really move our healthcare system to be more patient-centered. And to really be about health and not so much just about health care. So how do we do that? Well, first you have to define what's that model. What are we working towards? And we firmly believe in a primary care-based healthcare system. We know from studies around the country but also around the world that healthcare systems that have a strong family medicine or primary care foundation actually improve the health of populations and reduce healthcare costs and improve people's satisfaction with their health care. So when we face challenges, we don't, in the United States, have as many primary care physicians as we need. Even nearly 10 years ago, the American Academy of Family Physicians projected a shortage of 39,000 by the year 2020, and we know that shortage has probably only gotten worse. So there's a lot of factors in that, and we could talk a lot about what interests people in a specialty. But what I would say is, as people look to specialty choice, you want to have something that is fulfilling and satisfying, that is professionally challenging, and I've never regretted my choice of family medicine. We currently have about 32% of our physician workforce as primary care. Most of these other countries I mentioned that have better health have at least half of their physicians in generalist specialties, so we have a long way to go. And there's a lot that we can do to work towards that. So the Family Medicine for America's Health Project has a significant communication effort out to the public to have them understand the importance of primary care, not just to me, family medicine, not just to me, but why it's important to them as an individual, as a family, and as a community, because we know the health of all of those things improve when there is a strong primary care presence. And it's one of the, I think, both the challenges and the professionally satisfying pieces is the ability not to just engage in a health system in your office, but in the community, and through an advocacy presence to engage in working towards transforming a healthcare system. So we have a focus on improving primary care workforce. We have a focus on reducing health disparities and promoting health equity, about promoting the research foundation for primary care and the transformation that we want to see. And we also really are advocating for a change in the payment system that supports that primary care foundation, supports the medical home model, supports both interprofessional training, but also team-based practice in the medical home model. So those are things that we're actively advocating for. You know, there's a lot of forces at work in healthcare, and there's a lot of what I call inertia at rest. You know, there's a lot of people pretty satisfied because their hospital or their specialty or whatever is not doing that badly in the current system. But again, if it's not producing the health we need in our population, then the system isn't advocating and working as designed. It is absolutely never too early in somebody's career to be engaged in trying to work towards a better solution. And so, you know, often medical students say, gee, what can I do? But I've literally been in meetings with members of Congress where I was the president of my state chapter or even the national chapter, but we were with a student or resident meeting with that member of Congress, and they wanted to hear from that student or resident about their perspective about these issues we're talking about. So, you know, how can medical students be engaged? Efforts like this, thanks to everyone who's tuned in, but being engaged in the student outreach efforts of the AAFP, the ACOFP, the Society of Teachers of Family Medicine, all of those organizations, there's a lot of resources you can plug into in the way of what's going on in the changing healthcare system, again, through those organizations, but also through particularly the Center for Medicare and Medicaid Services in the government, hhs.cms.gov. They have alerts you can sign up for, because a lot of what's driving change is in government payment. Also, patients are really pushing for a better system. You know, our population is getting to understand how our system is broken, and our effort, Family Medicine for America's Health, is trying to align with this concept of originally what was called the triple aim and now the quadruple aim. The triple aim being improving health, improving healthcare delivery, but also reducing cost. And the fourth piece is a really important one about professional satisfaction and avoiding professional burnout. And that is absolutely a key to how we create a primary care foundation that can deliver on improving health. So in a nutshell, that's sort of what's going on with our effort. I want to give it back to you in a minute just for questions that have come from folks that have sent those in advance, but I would just point folks that are interested in more information. FMAhealth.org is the project's website, and then the communication effort to the public called Health is Primary has its own webpage called healthisprimary.org. Lots of information that can be printed off, given to patients, put up in clinic to start that dialogue about the importance of primary care. So with that brief intro, Lauren, I'd like to hand it back to you and help field any questions.
All right, thank you so much, Dr. Stream. We actually do have several questions that were submitted by medical students from all over the country. The first one is a two-part question. It is, what is change-making? And what is the role of family medicine in change-making?
Yeah, so I had to, this wasn't my title for tonight's talk, so I had to actually look up change making, and if you Google it, it actually has to do with making change when somebody pays in cash and you're trying to get them change back. So I'm pretty sure that's not what we're talking about. But in my own mind, I look at it as, you know, what's it like to be a change agent, you know, hopefully for positive change, but I've actually given talks about change management, about how how the world changes so fast, and how we all, no matter how progressive we are, get change fatigue, and it's an important skill, I think, regardless of what specialty anyone would choose to go into in their medical training. Dealing with change in a positive, constructive, stress minimizing sort of way, I think, is a key skill set for the modern physician. In family medicine, I think we have, and in primary care in general, I think have a unique perspective because we touch the healthcare system in more ways than anybody else. So, in my career, I've been in the operating room, I've been in the neonatal intensive care unit, I've been in the delivery room, I've been in the emergency room, I've been in a nursing home, I've been to patients' homes. No specialty more than family medicine understands the breadth of clinical medicine and the scope of the different sorts of venues where healthcare is delivered. So I think family medicine uniquely has the ability to exert positive change that way. I also think, and this is my bias as a family doctor, no offense to anybody considering another specialty, but I think that family medicine in particular has a unique interest and focus on what's best for patients, not what's best for me as a doctor or my clinic or my hospital. So I really look at that as our role.
Great. And we have one final question for you, and it is, what are some resources for students and residents to stay informed as the healthcare system continues to change?
So I think it's really important to sort of keep your finger on the pulse of what's going on, and there's really more resources than you'd ever want. So what you'd want to do is be pretty selective, or you'll be overwhelmed. So again, the student resources from the Family Medicine and other organizations, including the American Medical Association, the American Medical Student Association, all American College of Osteopathic Family Physicians, all of those have newsletters that I think are really good general resources. There's a whole number of free newsletters and other sources of information. Personally, it's more helpful if something comes to me and then I can drill down further if I have more interest, as opposed to remembering to go to this website or that blog. But American Hospital Association has an interesting newsletter that's free to sign up for. There's a whole list called Fierce Healthcare for IT or for payment or for hospital care, all different types of things. And I think more often than not, if you just Google, you'll find something of interest if you have a particular clinical or health policy interest that then would lead you to more specific resources. But I would say your primary source is whichever professional association you sort of trust for that information. So it might be AAFP, it might be AMA, but being tuned into at least one of those, I think, is just really, really important for folks.
Great. Thank you so much, Dr. Stream, for being here with us tonight and sharing your wisdom with us. A couple messages for everyone before we sign off. We do also invite all of you to tune in next week to the Primary Care Progress webinar about change makers in healthcare, featuring, once again, Dr. Stream, as well as Shannon Brownlee from the Loan Institute and Andrew Morris-Singer, founder and president of Primary Care Progress. That will be October 13th at 7 p.m. Eastern Time. Also, don't forget to check out our previously recorded topics from Family Medicine On Air. You can find those at aafp.org/FMOnAir. Thanks again for tuning in, everyone. Bye.
Thanks, everyone.